Before we were doing that central portion where I'm putting my chest contacts right onto one of the spinous process or in the region of one of the spinous process, I can make this thrust technique a little bit more unilateral or even a little bit more rib-based for the intervention based off of where I put that contact area. So if I drop my chest down here, then I'm going more for the spine. If I move it off to the side, a little bit more for a unilateral PA. Even further out, then I'm looking more rib. Now the one thing I would say with this is the movement and everything is the same except for the rib. The rib you'll have a little bit of a rotary component to it. So I'll do this side so you can see what I'm talking about. But here, with my stabilization, I'm going to actually bring him back slightly towards that side. And it's almost like I'm rotating his ribs into my chest on that side. Good. And then the breath in, breath out. And then I continue to do a little bit of a rotary motion by pivoting my hips as I do that thrust. Okay? So now that we've got everything here, I'm going to come back, make my contact point, and I'm going to take this arm and I'm going to tuck it into my body a little bit. Then most of the work of getting the patient set up for this manipulation is going to be done by moving my feet and my hips around the patient. So I'm starting off with my base of support predominantly on this side or towards me. What I want to do is I want to walk this around so that it's predominantly over towards the opposite side. Now Freddie's kind of stiff, so I'm not going to be able to get as far over as you may on some patients, but you can envision what I'm going to do. So I'm walking this around. How do I do that? I'm going to create an anterior, medial, and slightly superior contact point with this. And I do that just by rocking my pelvis underneath my arm a little bit. And then from there, I'll lock him up. Or create that pre-manipulative tension, and then just a little bit of a thrust with my hip, driving my elbow in. And that's all there is to it. Okay, so now we're looking at doing the technique where we're doing a distraction to the CT junction or upper thoracic area. So previously, you've been taught to have the person put their hands behind their head, like this, and then putting your arms back underneath them. They can rest their hands on top of your hands, whichever. Now with this one, something to be aware of is as you take up that slack and you bring them this way, if you have anybody who might have a positive ulnar nerve upper limb tension test or neurodynamic test, that might increase symptoms, which you don't want to do. So I'm going to show you another variation of this that will allow you to have a couple of different tools in your toolbox. Okay, so in this one, the way that I'm going to show you, it relies a little bit more on creating a skin lock at the kind of this upper thoracic area just below the area that I'm presumably trying to at least focus the thrust towards. So to do that, I'm going to really do the same thing. I'm going to get pretty low. I'm trying to come around the scapula as best I can with my arm contacts, and then just get them behind the head. Now from there, I'm going to go high with my body. So I'm not pulling on his head as I do this. I'm actually allowing my arms to move underneath me. Once I get there, I'm going to create my contact, and I'm going to sit down. And that creates a tension on the skin this way. So underneath, up high, and then back down. Good. And then from there, Freddie, relax your arms as best you can for me. And then I'm just going to slightly bring his head forward until I feel that tension build up on the other side. I'll have him take a breath in, breath out. And then I just lift up. If I feel I need to reset, I can go back and reset, relax him. Up. Now a big thing on this one is my force is coming by way of adducting against him and then using the arms to help lift up. I'm not doing a lot of pressure or co-contraction or pull on the neck while I do that. That creates a lot of my stabilization, and then the weight of the head as well as the arms helps me create the distractive force. Okay, so now the full thing, just in normal real time. I'm coming low, I'm coming low, I'm going high, bring him up, let your arms relax for me, Freddie. Good. From there, I'm just going to rock him back slightly to bring him over top of my base of support, and then breath in, breath out, and then just a slight lift. And that's coming predominantly from my legs, just straightening up. All right, so this technique is very similar to doing the central technique for the spine. However, we're working on trying to get one of our ribs here. So obviously we're limited by the scapula. If the scapula is in the way, you've got to come up with a different rib technique. So usually right around the 4th rib, 5th rib is the highest you're going to get with this technique. So what I've done to identify my rib is I go through, find that spinous process. I'm still sandwiching it with my fingers again. Move lateral, try to identify a transverse process. Move even further lateral to get on the rib angle. That rib angle is going to now be where I move my thenar eminence to. And then I can do a little bit of a lock as I move that person back onto my hand. Now, setup-wise, everything's the exact same, but this one, remember, we had to do a little bit of a lateral motion. So I'm not going to rock him all the way onto my hand here. I'm going to rock him so that that pressure builds up just right medial to my hand at that thenar eminence. He'll take a breath in, and then a breath out. And then my movement is not going to be towards the ground, it's going to be slightly lateral this time. So I'm coming this way versus this way onto that rib.
Start getting the patient and moving through an extension. So I quite like this. Oh, that just went. That just went. So all I'm doing is a gentle movement, watching my positioning, not using too much force, like so. We can add the rotation, like so. If I want to make it stronger, see, I'm just holding the patient's hand. Well, I'm looking up, yeah, like so. I'm adding in additional movement. Okay, keep your hand there. Go to the uppers. Push hands over again. Lows. Again, I can position myself as much as I like with the patient and just start to move, even with a broad contact, like so. Again, using my body positioning. Cross your arms over the dog.
Breath in, all the way out. Again. And then I usually just do it twice, but I'll keep it rolling and we'll do it again.
The second one popped.
The pop is not needed.
Yeah. Yeah. I know, I'm just saying.